Well, we are back on Morning Line. Our number has grown by 1 here this morning as we have yet another expert to join in the conversation. Take your phone calls as you see on the screen. We're talking about the Affordable Care Act enrollment, how important it is come January 31st to get on that with us this morning. And you know, Sharon Barker's been with us. And also Mary Moore. Nice to have you on, Mary. I know traffic's severe out there. Thank
yes,
you.
It is. Everyone be careful.
You're both with Get Covered Tennessee, and as she says, you're the numbers girl. So you know some of the numbers when we get into this. So just jump in as we get into the conversation. We have more callers we were going to get to this morning as we go over a lot of the important things you need to think about. And then we just keep emphasizing January 31st.
January 31st.
Don't pass on that thinking, oh, it's going away, because we don't know what's happening yet with Congress. So let's go next to, I believe, Robert. Hey, Robert.
Good morning, Nick,
Good morning.
Sharon, and Mary.
Hey.
Hi.
Hey, good morning. What's your question, Robert?
Well, I fall into the gap. I make about $1,000 a month. I'm self-employed. I have pre-existing injuries where I broke my back twice in the past 30 years. My wife and I are now separated. I don't qualify for any assistance. And, you know, like I said, I fall in the gap. Is there any way you can get a letter or anything to be able to keep from getting penalized on my taxes?
Okay.
Yeah, so you won't get a penalty if you're in the gap, but if you're looking for that exemption number, you would have to complete an application on healthcare.gov, and when you get your eligibility result, it will give you an exemption number, but you really don't need that if you're under the gap, in the gap, because you won't get that
Yeah, he shouldn't be penalized.
No.
He should not. Now, the question is, so right now, are you going without insurance?
Yes.
Yeah, because you can't afford it and you're in that gap. Now, have you, first of all, I assume you can work right now, so you don't qualify for SSI, right?
That is correct. I am able to work a little bit right now. I still have a lot of problems with my back. I make $1,000 a month approximately, and the Unaffordable Care Act said that my premium is $1,100 a month.
Yeah.
I don't understand that.
Well, yeah, that's
It's
because
insane.
yeah,
Sure,
you
exactly.
don't qualify for the tax credits with that income. Should you have a life-changing situation like you get a divorce and you come back into the marketplace after that life change of maybe getting a divorce, I'm not advocating that you get a divorce. I'm just saying if that happened or something like that, and you kept that $12,000 a month income, then you would qualify for tax credits and cost share reduction discounts, and you would see a very reasonable premium should that happen for 2017. And if a life change like that happens, you have 60 days from the date of that life change to come in and get the insurance, even if it's after January 31st when the enrollment closes. Should your life change qualify you for a special enrollment period and your family household size change and you're single now, then you would definitely qualify for a really affordable premium at $12,000 a year.
All right, that's some very great information. I am working on getting a divorce. I have to get enough money up to do that. It's
Sure.
kind of hard to do when you're self-employed. I only make $1,000 a month, and still making the house note and the land note and paying all the bills here at home.
Understand.
Well, listen, we'll just stick around too, and we'll put the number up again in a moment. But Health Assist, right?
Health Assist.
Now that's for those like him who are not eligible for TennCare or the marketplace. What kind of stuff can Health Assist offer up for him? I'm just wondering. And we'll have that number up for you later, so stick around, all right? But when he calls that number, what's he going to hear?
Well, they'll be able to look in his county, in his area, and see what kind of resources are available. Hopefully connect him with a sliding scale clinic in his area, or a doctor that will see him, without insurance, so that he can find a medical home to get some preventive care.
Sure.
Ongoing.
What if he, has strep throat? Right?
Yeah,
okay, he's strep throat, so if he needs to go somewhere, it can be a sliding scale, but then he'll pay what he can, or how this works at one of these clinics to get the throat culture, and then hopefully, if it tests positive, get the antibiotics to treat it, right?
Yeah, there's also prescription savings programs. Like if he's on any maintenance medication, they can look and see if there's a prescription savings program for that medication and sign him up for that.
That's just the safety net, right? Is that what that is?
That's
basically
safety net.
Yes.
So that 800 number will go up for those of you, and I'm really glad you called, Robert, because you're not alone. I mean, how many people are in the gap, would you imagine, in Tennessee? Any guesstimate?
It's about 280,000.
280,000 people are in the gap.
Yes.
That's a lot.
Wow. Okay. Let's go to Helen. Helen, good morning.
Good morning.
Hi, Helen.
Good morning.
Hi.
My question is, I am 2012. I lost my job in 2011, and in 2012 I was diagnosed with having cancer. Well, I didn't have at the end of the year I got insurance through the affordable health, and I had it for all of 2013. Well, then when I went to re-sign up in 2014, they told me I didn't have a income tax thing, so I didn't qualify. They told me to go try for TennCare. Well, I tried for TennCare. They told me I didn't qualify for it either. I mean, I'm supposed to have checkups and all, but yet I haven't had my checkups because I can't afford to go to the doctor.
So are you would she be in the gap or no? I mean, I'm trying.
Possibly. It kind of sounds like it might be a gap situation. Do you by any chance have breast or cervical cancer?
Cervical cancer.
Okay.
Yes.
There is a TennCare program for cervical cancer, and it's typically administered through the health departments.
I did sign up through the health department, and they said I didn't qualify for it.
Okay.
What would the reasons be that someone would not qualify?
There's some criteria. If your income is too high, that could be a reason.
What are you living on right now? What's your income now?
It's zero. I haven't worked since 2011.
So how are you living day to day?
Well, I'm living with my mother. I'm taking care of her, so we're living together.
I gotcha. Okay.
And she's drawing Social Security, so basically we're living off of what she makes.
Wow, that's a tough pickle. Okay.
Yeah. But I was going to say something and I forgot.
That's all right. Well, now, is she someone that should call you guys, maybe?
Yeah,
I mean, we may not be able to do.
Yeah.
Listen, get a pen and paper, and before the end of the show, we'll have the number for Get Covered Tennessee up. And if she calls your office, then you guys can go into more detail than we can on this show.
Work through some
To just maybe
details
point her in the right direction.
Yeah.
Are you in remission for cancer right now, and they're just trying to monitor it, or are you still being treated for cancer?
No, I had the cancer surgery, and I was supposed to go back for checkups, and I haven't actually gone back since I had it. And because I can't afford it, because it's like $250 to go see the doctor, and I just don't have the money.
I understand.
She couldn't possibly qualify for the Affordable Care Act with household income. So if her and her mom live together, and maybe the household income, if she files taxes with her mom, and her mom claims her as a dependent, and her mom, we could see what the income is to maybe possibly see if she's eligible, but she could call us and we could definitely see.
Okay, so Helen, just make real sure you stick around. We'll get the phone number up. You go get a pen and paper and call that and deal with it. And here's the thing for someone like her, it's why it makes sense for all of us in terms of money. She's had her surgery and she's in remission. The important thing now is to monitor and make sure nothing comes back. And if there was a polyp or something that developed, they could get rid of it right away.
Absolutely.
If she doesn't get tested and it comes back full blown, then God forbid, then she ends up having a very expensive re-procedure, and that's why this is preventative.
That's right.
And it's crucial, I would think, for her because obviously her life and the cost.
And those screenings are free right now under the Affordable Care Act.
Okay, then we need to. Okay, so Helen, you make sure to call to see if we can get you on there, and you hang in there, okay?
Yeah.
I'm sure they'll be able to give you some options. Let's go to Brian. Hi, Brian.
Good morning, Rainville.
Oh, yeah. It's way out there, huh? Where's the sun? How are you?
I'm eating my yogurt, trying to stay healthy.
I hope it's Greek yogurt. I hope it's Greek yogurt, Brian.
It's plain. My woman said that the blueberry kind are fake blueberries, so I got the plain.
I don't believe that, but all right. What's up, my friend?
Yeah, last time I called, you were on the evening show with the lady, and I asked them, who employs them, and they said, we're a nonprofit, and then I couldn't come up, of course, and they go, we're a nonprofit, and then she said something that struck me. She goes, and it's government, it's federally government funded, and that's part of the Affordable Care law. I'm like, well, wait a minute, I know you're being funded by the government, and last time I heard, I think the government gets their money through taxes, so that would be like my taxes. So this is, I know you want to avoid the political thing of it. You'd be shocked to hear, but I'm in favor of a nationalized health care program like they have in England and Canada. So, I'm not on their side. It's just, I just don't appreciate the shell game that's going on with everything of it. and stuff, and that probably leads to more costs. And I'm telling you, Trump's a smart guy.
Well, listen, if you want to just clarify then, yeah, I mean, you are a nonprofit, and how this works. I know the dollars come from, is it a federal grant, which is designed to be there because they know people are going to need help getting through the process?
Yeah, I mean, it's very critical, especially with it still being a fairly new program, that there's in-person help available locally for people, especially because the application process is done online, and there's varying levels of comfortability with the online application. Not everyone has a computer, so we're able to go out into the community with our laptops and really, bring the application to people and walk them through the steps. So it's actually built into the Affordable Care Act that there be in-person assisters to help with the enrollment process. So
and that makes sense. So that essentially answers it. Whether there's money being spent that way, it's just part of the program.
It's part of the program.
And it's not hidden or some shell game. It's budgeted for services like what you guys provide. And neither one of you are getting rich.
No. Not at all.
You don't do this for the money. All right. Let's go to Jackie. Hi, Jackie.
Hi.
Good morning. How can we help you?
Yes, I was wondering. Unfortunately, my son has had to do a year in detention, and he's run across some health issues, and he won't be out in time to enroll by the 31st. Can I possibly enroll him?
That's an interesting question.
Absolutely. Actually, that's a population that I help quite often. I go over to the detention off of Harding Place, and a lot of times when the people are getting ready to get out, I go over there and help them to understand, what their benefits are when they get out. They have 60 days from the date of release from jail, detention, or prison, or whatever it is, to enroll. So you have a special enrollment period when he gets out.
Oh, okay. So I'm saying, so for him, when is he due to come out?
The next couple of months.
Okay, so let's say he comes out, and it's going to be after January 31st. Because he is incarcerated, that deadline doesn't apply to him. He then will have 2 months to do his thing. So did you hear that? And that was a great question. But the January 31st deadline does not apply to him.
What do we need to do to show them that he has been in?
Yeah, so when we do the application, it will find him by his Social Security number and probably ask for proof of his release. Usually it's a letter from somebody in the community saying that he's living there, or a job pay stub, or his actual official release papers, and then we'll upload that to the application. But a lot of times that's what happens with that population. We can get through the application, but by that Social Security number, it'll ping that person was incarcerated or in detention.
How many days?
And then 60 days. And if you call the 1-844-644-5443 number, you can make an appointment with us when he gets out, and we'll help him. Are you in Davidson County?
Rutherford.
Yeah. Rutherford County. That's fine.
Mary Elaine has put the numbers up again that I've been talking about for the last 2 or 3 callers. Go ahead and grab a pen and paper. We can leave that up for a moment. We'll take more calls. But Get Covered Tennessee, it's these 2 individuals with us, and your office has a staff of what, a couple others as well? And
there's about 25 navigators across the state.
Oh, across the state, okay. And you guys are here in the metro area? All right, and so we'll put that number up again before the end of the program, but get that to call, and then the other number up there was Health Assist, and that's for some of the folks we've heard from today that don't qualify for a Marketplace or the 10 Care program. It's kind of a safety net for those who have nothing at all. Let's go to Jill. Oh, and you know what? Before Jill, stay where you are, and we'll take your call as soon as we come back from this break. Stay with us.